Hello, friends. So today I'll be talking on this important topic, sustainability in quality improvement in healthcare, redefining value. So this is a contemporary topic. So I remember 10 years back when we spoke about quality, it all appeared very new to intensive care. So now the word that is making rounds in healthcare and more so in the intensive care in the backdrop of COVID is sustainability. So sustainability has become a buzzword in most of the organizations at this point of time. So predominantly the word sustainability refers to taking care of the environment and social values when we talk about delivering healthcare or any sort of an organization that deals with anything in particular. So we'll just look into what sustainability means with regards to intensive care and to the healthcare. So the topics that I would cover is sustainability as a domain of quality in healthcare. So now the whole concept is integrating sustainability within the quality, and we call it at a SusQI sort of a framework. So before we used to use the word QI, now it will be SusQI. It is sustainability integrated into the quality. And we look into what are the key determinants of quality and where this sustainability figures out in this quality and why healthcare sustainability is important. And we look into inclusion of sustainability into quality and quality improvement. So there are four aspects to it, how to incorporate sustainability to set the goals and studying the whole system and designing the whole continuous improvement and understanding or ascertaining the impact of sustainability into the healthcare. For this, there is 7 domains, which we call it as 7 capitals matrix, and embedding sustainability into practical sort of a clinical example. So we will cite 2 examples. One is asthma and one is catheter-related bloodstream infections, which tends to occur in intensive care. And we look into different clinical situations within intensive care, how sustainability can be incorporated. So when we talk about incorporating sustainability into healthcare, we call it as actionable points, secondary drivers, primary drivers, and the goals or the endpoints that one would have attained and the conclusions. So these are some of the topics that we'll try to cover in next 20 minutes. So we'll talk about sustainability as a domain of quality. So when we talk about any healthcare service, it means that we deliver healthcare to an individual, and it's not only individual, to a larger population, keeping future in mind. So this is what we understand what healthcare is all about. And this healthcare has to be is something that is that needs to be sustainable over a period of time to deliver the care. And this is in the face of increasing demand that is going to happen in the healthcare with dwindling resources. So there are going to be huge economic constraints, but there'll be increasing demand. So how we make this whole ecosystem sustainable is what we need to look at. And all this delivering healthcare in the face of increasing demand with dwindling costs will be further constrained by the social system in place, which means there will be more elderly population that will be there in the community, and the care providers for this elderly population would be affected or would be dwindling because there would be no personnel to look after these elderly people. And the constraints of taking care of the environment, reducing the carbon print or carbon emission becomes an important entity, and it's a quintessence of the whole sustainability that we are talking about. So reducing the carbon emission goes a long way in maintaining the sustainability of the healthcare. So the whole focus is to reduce carbon emission by 80% as we move forward. So when you talk about quality, the determinants of quality, there are 7 dimensions to the determinants of quality. One is increase in the efficiency. So obviously there has to be increased efficiency within the healthcare system to improve the quality. And providing care in a timely way also is one of the important determinants of quality. So any delays will hamper the quality of care that is provided. And taking care of steps to provide adequate safety measures and to minimize errors all becomes an important aspect of quality. And the patient satisfaction also is an important determinant of how effectively healthcare is being provided with quality. And effective healthcare that is going to be provided becomes an important determinant. And equity, because we have seen in during COVID that the healthcare provision was inequitable because the lower strata of the society suffered, or the marginalized sections of the society did not get the type of care that the other sections of society would have got. So having an equitable approach to providing healthcare also is an important determinant of quality and sustainability. So when you see the sustainability also is embedded as an important determinant of quality. And when you look at sustainability, it runs through the whole system, how we are sustainable in addressing the equity, how we are sustainable in providing effective care, how one is sustainable in providing good patient satisfaction, and how one is sustainable in minimizing the errors, how one is sustainable in providing timely care, and how one is sustainable in improving the efficiency. All this, so the sustainability as a concept runs through all the other determinants of quality, and that is where the whole concept is to integrate sustainability as a key component of the quality. So that is what every intensive care listeners need to understand. And when you talk about health service, as a doctor, we are all sort of ingrained into providing care to an individual. So now the whole emphasis is it has to move out to provide healthcare to the whole population. And we witnessed this in pandemic, how we were involved in delivering the care to the whole population in preventing the spread. So providing care to the individual and to the population is dependent on functional ecosystem and extensive social network that governs this, and the economic opportunities that are available to providing the care. So there is an increasing emphasis that the healthcare domain not only is involved in the providing health to the patient, but also should involve itself into education and training of larger section of the society. And this should provide good employment opportunity, political empowerment, and it should widen its horizon to providing care to other, or to providing support to other social determinants of health like exercise, good diet, and minimizing the air pollution. So what this means is doctor's responsibility is not about treating a disease, but rather promoting health in encompassing the determinants of health. So we are going towards treating the disease towards more preventative aspect, taking measures to provide general health in the community. That is what whole sustainability, because we need to lessen the burden on the existing healthcare facility by promoting health in the society, by education, training, and which will has a bearing on providing employment and having a role in creating policies. That's what we say political empowerment. So doctors should extend their role in having influence on certain policy making and in the governance. And we witnessed this during COVID, where we were involved in formulating certain policies within the government. So this is where we need to head to create the healthcare which is sustainable, because we saw in COVID that the whole healthcare system sort of crumbled, and sustainability did get affected during the COVID. So the key aspect of health service is to promote health and prevent disease. And by promoting health, what it is shown is it significantly curtails the cost. And when we say why healthcare sustainability is important, there are two aspects to it. One is the practical aspect and one is the ethical aspect. The practical aspect is to provide obviously high quality care, and this should be sustainable into the future within the constraints of the social norms that prevail, and adding social value, and by reducing the cost, and by taking care of the environment, which is curtailing the carbon emission or carbon footprint. The ethical value is, so ethically, healthcare establishments are bound to reduce the climate change by reducing the carbon emission and by encompassing all the other social determinants of health, which is promoting health by good exercise, nutrition, and reducing the air pollution, and so on and so forth. So there is increasing emphasis on community-centered health, which means to say we saw this in COVID, where hospitals could not take the burden of all the COVID. So we went on to community to educate them about the home quarantine and empowering certain individuals within the community to prevent spread of the disease by effective quarantining within the apartments or be it within the gated community. So that is what we mean by community-centered approach, in trying to empower the community to take care of the health of the individuals within that community. And this has shown to improve outcome. And by incorporating this during COVID, it was shown that a saving of 950 million pounds was achieved when you try to quantify the community's empowerment or involvement in the promoting health. So empowering community goes a long way in making the healthcare sustainable. And so we need to pay attention on redefining value. So the value is defined as the type of outcomes with regards to health we achieve in an individual and in a population amidst the social norms, and by adding social value and by reducing the environmental pollution or by reducing the carbon emission in the environment and by curtailing the cost. So the outcomes we derive by reducing the cost, reducing the carbon emission and adding social value is what determines the value of the health. And the value of the health happens with increasing efficiency with regards to this. And this is important thing I want intensivists to pay little attention. So the value of the healthcare organization gets enhanced by avoiding underusage of overvalued interventions and by avoiding overusage of undervalued interventions. So this becomes very important for any of the healthcare professional to avoid underusage of the overvalued and avoid overusage of undervalued interventions. And there is a emphasis on reducing the carbon footprint by creating carbon budget, because there is a buzz uh, on policies to create carbon budget so that the carbon emission is reduced, which has a direct and bearing on reducing the prevalence or occurrence of certain preventable diseases like asthma or even cancers. So carbon budget is something as a healthcare community we should work towards creating so that the carbon emission reduction can happen and promotion of the health can happen. So when we look at what is the inclusion of sustainability in quality for the process of quality improvement, so gone are the days where doctor's role is limited to taking care of the patient. So doctor is involved in the whole healthcare ecosystem where multiple other domains are present. So you have healthcare establishments, you have nursing staff, you have paramedical staff, you have ambulance services, you have home care services. So doctor's ability to influence has reached beyond taking care of one patient, and it is moved towards, and doctor has an onerous responsibility of paying or putting efforts for quality improvement, which is ongoing systematic effort, and he needs to integrate this sustainability within this quality improvement that he gets involved in. And this is called as SusQI framework, which is called Sustainability Quality Improvement Framework. And there are 4 dimensions which govern this SusQI framework, which is setting the goals and trying to study the whole processes that are involved in integrating sustainability within the quality improvement, and to understand the continuous improvement, to understand the whole continuous improvement that needs to be put in place, and studying the outcome by looking at the impact that these things are put in place. I'll talk about the practical example. So sustainability, when you hear to all this, it appears to possibly my intensivist friends that this is only a theoretical concept. So it is not theory. We will show you examples. So it is not a theoretical concept. So this can be applied to every disease in intensive care, and we could look at continuous improvement of the care in a sustainable way is what this whole SusQI framework tends to attain. So the goal is again to, the whole goal would be to enhance the quality improvement by maximizing the sustainable value. So by what we mean is improving or maximizing sustainable value happens with maximizing health gain. And I keep repeating this. So maximizing health gain by curtailing the cost and by reducing the carbon emission on the environment and by adding social value. So this is what is the quintessence of sustainability. So at the end of this talk, if my intensivist friend just remember that sustainability is how we attain maximum health gain with curtailing cost, curtailing carbon emission, and adding social value by community-centered approach is what the whole sustainability is all about. And this involves resource stewardship. Resource stewardship is identifying the right patient at the right time and giving the right care. So this is what is called resource stewardship, and this also forms an integral part of the whole SusQI framework. And studying the system means that we need to constantly look at all the inputs that are put into the healthcare and the output we derive. and trying to identify all the wastages that happen and the potential assets by studying the inputs within the health organization and the outputs that we derive and looking at all the wastage that may be generated. And this goes a long way in reducing the carbon emission and will help the medical professional to get into the creative sort of a thought process as to how effectively the wastage can be minimized, and it would radically change the way the healthcare worker would look at. So when we talk about it, so one would be wondering what is the sort of wastage that we are speaking about. So this wastage is coined by the word carbon hotspots. So if you look at this healthcare establishments as an ecosystem, so if you see, these are all the significant carbon hotspots that have been identified. If you look at all the pharmaceuticals that are utilized, that is carbon hotspots. And if you look at all the medical instruments and equipments that we use within ICU, that increases carbon emission, and that is a carbon hotspot. And when you look at all the building structure and the lighting that we use within it, and the power that we use to run a healthcare ecosystem, all these are carbon hotspots. So the whole emphasis is to see how we can curtail and minimize these carbon hotspots by using more of natural lighting and by minimizing the use of certain equipments, which I said. So avoiding the underuse of overvalued interventions and avoiding the overuse of undervalued interventions. So this becomes very important to make healthcare resources more sustainable. And the way we make it more sustainable by reducing the carbon hotspot is adopting the 7 capitals matrix, constantly looking into the revenues and trying to prevent wastage of resources, and looking into the whole revenue model goes a long way, and trying to look into streamlining the expertise of the healthcare workers and infusing motivation into the healthcare workers and the timely interventions by the healthcare workers. So basically what this matrix talks about is increasing the efficiency and effectiveness of the personnel involved in providing healthcare so that the wastage is mitigated. And this is what can make healthcare sustainable. And this is called as 7 capitals matrix. And the commitment that one shows towards the patient, the skill set that is imparted to the patient, and the compassionate treatment that is given to the patient, and extensive source of a social networking within the healthcare organization helps in minimizing the wastage of resources and makes the healthcare more sustainable. And this we already spoke about, the community-centered sort of a approach towards preventing health, to preventing diseases and promoting health by creating social support group and having charitable organization, and the infrastructure to minimize the carbon hotspots, and incorporating natural elements within the healthcare ecosystem by the quality of the air and minimizing the water wastage. All this goes a long way in making healthcare sustainable. So there is Center for Sustainable Health that is created, which looks into 4 important aspects of making healthcare sustainable. So one is prevention, which is predominantly looking at promoting health. So our focus basically, when you look at this whole narrative, the common entity that is getting resonated is the effort should move towards promoting health and preventing disease rather than taking the burden of the disease to treat in the healthcare organization. So this is where the whole focus is moving, and to reduce the burden on the healthcare and empowering communities to safeguard their own health, and community-centered approach to look after their own health and try to minimize the burden on the healthcare establishment is an important aspect. And we call something called adopting lean system. Lean system is trying to minimize the wastage of all the resources that are put into the healthcare system and optimizing the available resources by increasing the efficiency and adopting that 7 matrix that we spoke about, 7 capitals matrix, will promote the lean system. So lean system is a managerial lingo where it is mainly to effectively optimize the available resources and minimize the wastage of resources and avoiding low value interventions. So this is something called lean process. And all in all, to put a conscious mind into reducing the carbon emission in the workplaces that we are in, and reducing the usage of paper and reducing the water consumption also is an important tenet of creating a sustainable health and reducing the carbon emission. So now you have heard all these theoretical concepts. So for me, one thing, if you go home remembering, is the sustainable health is to provide maximal health gain by curtailing the cost, reducing the carbon emission, and adding social value. So one would ask, how can we apply this practically? So I will show an example of asthma. So, so when we talk about how we put it practically, so Center of Sustainable Health have called it as actionable points, which will lead to secondary drivers, which will lead to primary drivers, and the final outcome. So the actionable points in asthma is having extensive campaign against smoking and improving the home environment to reduce the carbon emission and reducing the smoke pollution and improving the quality of air. So these are actionable points. This will lead to possibly reduction of smoking, reduction of cold exposure, and reduction of environmental pollution. And what the secondary driver will lead to is primary driver, which is preventing avoidable disease or avoidable respiratory diseases, be it asthma, be it cancer or anything. And the actionable points preventative is to undergo, see, this is community empowerment. So community centered initiatives to take care of their health is to undergo annual health checks and to have rescue kits within their home and to undergo pulmonary rehabilitation exercises. So this is actionable points. What will this lead to is the activation of the lean process. Lean process is reducing the burden on the healthcare organization because they are looking after their health by going through the health screens and by undergoing pulmonary rehabilitation. So they're lessening the burden on the healthcare system. And the primary driver is the individuals are empowered themselves to look after and safeguard their health. So the actionable points is reducing the paper usage, and actionable points is to review the inhaler usage and adhering to the guidelines and recycling these inhalers. So the secondary drivers one would achieve is to reduce wastage of these inhalers and optimize the inhaler use. And the primary driver you would attain is reducing the carbon emission. So you can see how these can be put into practice and reduce the carbon emission and make the healthcare sustainable. So this is what is all about sustain. So you saw a practical example how by doing a campaign on anti-smoking, it would lead to improvement in the air quality and reducing the respiratory diseases. And by optimizing your inhaler usage and recycling inhaler usage, you are reducing wastage and reducing the carbon emission. So the outcome is improved sustainability. So I'll show you how. So the intensivist listeners would possibly raise a question as to how this can be applicable in ICU. So we look at catheter-related bloodstream infection. So the actionable point is so having so minimizing the use of CVC usage, because right now we use CVC usage only in select group of patients, and having a screening tools to inspect the sites to reduce the risk of infection, and having a checklist when we are putting CVC, and every day like we have CRBSI bundles, having a checklist to see and recognize infections and training the personnel on blood drawing from the CVC line and the type of CVC catheter, because we know subclavians may be little superior than femoral, and keeping a tab on how long the CVC should be in place and the care of the CVC line. And there are different ways, like you have non-tunneled catheters and the aseptic precautions that are utilized in inserting a CVC catheter and minimizing repeated manipulation. So these are all actionable points which one should possibly put their effort in intensive care. So what will this lead to? So this is an actionable points, and training and education of the nurses as to how they should look after the CVC, how they should go through the catheter-related bloodstream CRBSI bundles, and how they should be drawing the blood, and how important it is to take good aseptic precautions or universal precautions while inserting this catheter. So these are actionable points, and adhering to the guidelines for CRBSI and recycling the equipments that are used in putting a CRBSI or the dressings, and in fact moving forward to look at using biodegradable material for the catheters, because we know we use plastic in or other materials in central venous catheters. So using biodegradable sort of a catheters goes a long way as actionable points. And what are the secondary drivers we would achieve? Reducing the CVC use and optimize your dressing and reduce the risk of infection. And this will lessen the burden on intensive care. And the primary driver would be you would have facilitated quality improvement by reducing CRBSI rate and reducing the burden on the health. When I say reducing the burden on the health, It means reducing, you would have achieved maximal health gain, curtail the cost to the patient by avoiding unnecessary usage of antibiotics, and you would have reduced the environmental duress by carbon emission by incorporating all this and adding sort of social value. So this is how we could look at how it can sustainability is something that can be put within the intensive care armamentarium as well. So just the last couple of slides, embedding sustainability. So sustainability is an integral part, and it should be a part of education and training in any healthcare, and a culture of resource stewardship needs to be incorporated, which is identifying the right patient, giving the right care and at the right time. And there is National Quality Board, which talks about shared commitment to quality, which is integrating sustainability as into the quality improvement. And adoption of SusQI is recommended to be a separate sort of a category that needs to be put into the curriculum of any healthcare. And there is a recommendation to give awards to any sort of a healthcare professional who integrates sustainability into the quality improvement and takes necessary and puts in actionable points to derive the secondary drivers and the primary drivers and improve the sustainability of the healthcare. And the Royal College of Physicians has incorporated SusQ into their regular sort of a healthcare domain. And there's more research needed into this sort of sustainability as to how sustainability as an entity can be incorporated into various sort of a practical applications within the healthcare. So when you talk about intensive care, so there are at least 7 domains which I believe where sustainability could be integrated. We spoke about CRBSI, how sustainability could be incorporated. Antimicrobial stewardship is an important area where sustainability could be incorporated or intertwined into the quality improvement. And prevention of CRBSI, WAP, and CAUTI also we could incorporate the drivers, actionable points and the drivers. And homogenizing intensive care across the board by good education and imparting skills is where some sustainability could be incorporated. And sustainability could be a part of the conflict resolution because conflicts are often arise in intensive care domain. So sustainability as a concept could be integrated into conflict resolution. Most importantly, intensive care, I believe, for curtailing the cost, sustainability is something that could be incorporated. And not to forget doctors' own well-being, because doctors get burnout in intensive care. So sustainability as a concept, I believe, could be ingrained into doctors' well-being as well and into end of life. So these are around 7 dimensions which I have identified where sustainability is a possibility as a part of quality improvement within intensive care. So this is something where we could do research and possibly we could champion the sustainability as a concept into the quality improvement within the intensive care. So this is food for thought for all the listeners, how sustainability can go as a part of intensive care domain also. So this is just, I think I'll just skip this. So to conclude, as you see, if you look at quality as a macrocosmos, so sustainability forms an integral part of this quality. And by adopting this sustainability as a part of quality, so we could curtail the cost, improve the environment, and add social value. So all these 3 are intertwined, and sustainability needs to be integrated into the quality as a SusQI framework. And the resource stewardship has to be ingrained into quality, which means identifying right patient and giving right care at the right time. So that is what we understand by resource stewardship. And this goes a long way in reducing the climate change, reducing the carbon emission, and reducing the carbon print. And for that, we should possibly think of creating a carbon budget as a part of a political policy or a political empowerment. And it will create more of social equality within the community by community empowerment or community approach, community-centered approach to this sustainability to promote health and preventing disease will create more social sort of a equality, and having a sustainable lens to everything that we deal with in the healthcare is what leads to immediate benefits. So this is, if you remember this slide, and one important thing about the value is where we attain maximal health gains or improve the health, promote health, prevent disease by reducing the cost, reducing the carbon emission, and adding social value. I think that remains the quintessence of sustainability, and resource stewardship is something that we need to bear in mind. And then we need to be cognizant of the carbon hotspots within the healthcare organization, which increases the carbon emission, and try to take measures to recycle, reuse, and reduce the usage of a lot of things. And we showed that CRBSI, where possibly we have reduced the use of CVC catheters, and that goes a long way in reducing the risk of CRBSI. And you saw how it has an impact on reducing the carbon emission and making the healthcare more sustainable. So thank you one and all. So I end with this quote: sustainability is here to stay, or we may not be. So thank you one and all.